Welcome to this week's edition of Health Corner. I'm Dr. Parker. Today we're talking about urinary incontinence in women. This is a gynecology problem, and today we have the pleasure of inviting Dr. Thakur, who has been to this show before, to speak to us about the causes of urinary incontinence and some of the things we can do. Dr. Thakur, you're welcome to Health Corner.
Thank you very much again. Thank you for having me here.
Can you explain a little bit about urine incontinence in women? Because there are so different causes, we know that, but the viewers probably would like to hear from the specialist.
Thank you. Dr. Parker, the urinary incontinence problem is roughly seen in about third of women, so about 30 to 35% of the population, adult population, have some kind of urinary incontinence, which obviously they don't come across to doctors because of it is a bit of a embarrassing problem. It is personal problem, so a lot of women don't talk about it, but it is fairly common problem.
Right.
And one of the surveys which have shown the figures, which are pretty astonishing, but I do not necessarily mean that these figures are final figures. It can change, but some women cannot go out of their house, or they cannot socialize. Up to 50 to 60% of the women said that they cannot go out because they're worried, because they feel they can wet themselves, they're feeling a bit smelly, they cannot use the public transport because they're worried they will not find the toilet on time. Some of the patients do not have intercourse because they're worried during intercourse they will have a urinary leakage, and hence they avoid sexual activity. So it can be quite debilitating condition. Unlike your heart disease and cancer where patients are likely to die, but here they can have a lot of depression, they get isolated, upset with this problem. So it can be quite distressing. Now, when you come to urinary incontinence, the reasons for them are generally, it is related to, in women, it is more prevalent in women than men, and one of the commonest reason being childbirth. During childbirth, as you know, the pelvic floor of women consists of all muscles within the pelvic floor, which I can demonstrate here, and they cause contraction and relaxation of muscle, and hence when you feel that you want to go to the toilet, you contract your muscle and avoid. So if there is no toilet, you tend to contract your pelvic floor muscle so you don't pass water. However, this muscle gets damaged following childbirth, and you lose that control because the muscles are not functioning as good as they should be, and hence a lot of women lose the control of their urinary system. Similarly, after you finish your period and become menopausal, the tissue laxity, the collagen within the tissue becomes less and less because there is less estrogen hormone. And that is again important reason after menopause a lot of women start having problems with their urinary system. As age advances, again, this problem becomes worse. Even in men, after a certain age, because of prostate problems, it becomes worse. The obesity or bigger the size makes this problem worse. So higher your BMI or higher your weight makes this condition further worse for these women. Having a diabetes, that means you have problem going to the loo frequently because diabetes causes more urine formation. So a lot of women tend to find it difficult to control their water work. And other things are, some of these conditions are related to your lifestyle because you drink too many cups of teas and coffees, you drink alcohol, that can cause increased urination because it forms more urine, and the chemicals within this caffeine or within the fizzy drink can affect your bladder and cause more irritation. In the women pelvic floor, you got these muscles which controls your water work area, As you can see, the bladder is like a balloon, and that is the neck of the bladder, where if you tie the balloon, that is where the neck of the bladder is. So these are the muscles around it we call sphincter, which controls the bladder mechanism. So if you press the bladder from the top end, normally you don't pass urine because your sphincter is working very well. You can see in this picture, the neck of the bladder or the water pipe has more pressure normally than the bladder, and hence you do not leak the water when your bladder is full. But the pressure within the neck of the bladder becomes less. If it drops down or it relaxes, if the support is not good enough, then when you press the bladder, when you press on the top, you tend to leak, you tend to pass the urine. And hence, the childbirth is one of the reasons for having a problem with your water work area. Now, when you come to the causes or types of urinary incontinence, predominantly there are two types. The first one is called stress urinary incontinence. The word stress is not the mental stress, but it is a physical stress. That means when you strain, when you cough, when you laugh, when you do physical activity like run, you tend to pass urine, you tend to leak urine involuntarily. And that is called a stress urinary incontinence. Normally we say laughter is the best medicine, but in this situation it is not, because more you laugh, more you leak. And the typical example is women has a incontinence when she opens the door. It's called door and key incontinence. As soon as you open the door, sometimes some women cannot reach the toilet. Before they're reaching toilet, they wet themselves. They have to get up frequently at night, and they're sometimes what we call as toilet mapping. So they look for toilet all around the place. And these are the people who sometimes having difficulty in traveling, because suddenly if they get that urge, they have to find the toilet. And sometimes you get the combination of these two conditions. So you get stress incontinence as well as you get urge incontinence. How do we manage this patient? How do we investigate this patient? So the woman presenting with these symptoms to us, we try and identify which type of incontinence she has by just merely taking history and establishing which way her symptoms are going. Following that, we do examination to see if they have a prolapse or any childbirth related damage to their pelvic organ. Then we make sure they do not have urinary infection. So as shown in this slide, we make sure the urinary sample is checked for infection. And then we give them a bladder diary or a chart to manage for 3 days. So 3 days they tend to write how many times they're going to the toilet, what type of drinks they have, how many times they have incontinence. And all these 3 days diary help us when they come back to establish what are their drinking habits like. For example, if somebody is having 10 cups of coffee in a day, I can immediately make out this is the person who is likely to have more urgency or frequency because of merely taking more coffee. So we can advise them there and then. So this frequency volume charts are fairly useful and gives us overall picture about their fluid habits and their problems of their water work issue, and we can assess their quality of life. If she's getting up 5-6 times at night, then we know her quality of life is really poor because she's not getting good sleep. Now, how do we manage this condition? How do we treat these patients? If they have a stress urinary incontinence, that means they're leaking on their physical activity, then we tell them to strengthen their pelvic floor muscles. And we usually refer them to a specialist called physiotherapist who try and find out the strength of their muscles. So they gauge the muscle strength in the beginning, and then they give them specialized exercises and making sure they strengthen their muscle. Merely by doing these exercises, a lot of women feel better and their incontinence become less. Once we explain to them about the anatomy, what we've just shown on this picture, that once they know how their pelvic floor functions and what exercises to do, it helps women to improve their incontinence as well as prolapse.
Right.
So by doing this pelvic floor exercises under supervision definitely helps.
How long are they expected to do the pelvic floor exercises as?
Normally, by NICE guidelines, or National Institute of Clinical Excellence guidelines, we recommend them for 6 weeks to 3 months.
Okay.
And after that, we assess them again to find out whether they've improved their symptoms.
Thank you very much for that information. If you're just joining us, today we're talking about urine incontinence in women. We have the pleasure of listening to Dr. Thakur, a consultant gynecologist. We'll take a short break. Stay tuned. When we come back, we'll continue on how to treat this problem.
Meet Anne. Anne is thinking about sending goods to Africa. Her first thought came to MDS Cargo. Send goods to Nigeria, Ghana, and many more countries in Africa. Excellent customer service and after-sales support. Free London and Essex collection. Online tracking.
Health Corner on Ben TV by Crystalife is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show by Crystalife.
Welcome back to the second segment. If you're just joining today on Health Corner, we're talking about urinary incontinence in women. And this topic is being discussed with a consultant gynecologist, Dr. Thakur. Dr. Thakur, I know you gave a very good background in the first segment about the different types of urinary incontinence. What are the things the viewers can do? I mean, if anyone has got urinary incontinence, right? There's the mixed type, there's the urge one, there's the stress one. Is there anything they can do with their lifestyle based on the causes? And are there other treatment options which may benefit anyone who is suffering from this?
Definitely, I think definitely. There's a lot of things which they can do themselves. One is reduction in intake of coffee or tea or any fizzy drinks. Alcohol itself can reduce the frequency and urgency of going to the loo. Similarly, if they're obese, if they have a high BMI, they can try and reduce their weight, because pressure of the weight on the pelvic floor itself can cause urinary incontinence. So they can certainly try and weight reduction can help them. And doing pelvic floor muscle exercises are one thing I would recommend to everyone, especially people at childbearing age. After having children, their pelvic muscle becomes weaker. So to improve them is important. And some of them exercises are available on websites, so they can look for those websites and try and strengthen those pelvic floor muscles.
That's very good, because they don't have to see a physiotherapist. They can actually start that at home.
Absolutely, they can do that at home. Some of the devices which are available in the chemist, like using small vaginal weights or cones, which can help them to identify which muscle to strengthen. Because a lot of time it does happen when you do your exercises for your biceps muscle, you know what to look for. But pelvic floor muscles are not seen. Hence, sometimes we give them something to identify those muscles. So sometimes keeping a weight inside the vagina, they know which muscle to contract. And then they tend to increase their weight so that they improve the muscle tone further. And sometimes if that doesn't work, then obviously they have to see physiotherapists who can give the nerve stimulation, electric stimulation, and improve their muscle strength.
Right. Excellent.
Now, continuing from that, if this particular treatment doesn't work, and if a woman still have a persistent stress-related incontinence, then they can be offered surgical treatment. And you probably have heard, or listeners probably have heard about something called transvaginal tape, which is a sling surgery, which we carry out in the hospital as a day procedure.
So
As you
that's
can
what
see
picture
on this
shows,
picture, these are the tape, which is a small sling, which is of this size,
Right.
which goes inside, and it goes round your neck of the bladder, and it forms a hammock in order to stop the urinary leakage.
Right.
The analogy I give it to my patients is, if you have a leaky tap, your plumber comes in and changes the washer. And similarly, in transvaginal tape, we put new washer so that the leakage stops. So that strengthens your neck of the bladder so you don't get the leakage or leaky tap. Going back to the other problem, which is the urge-related incontinence, that means they're going to the toilet or loo frequently and having urgency, then we tend to tell them, first of all, to avoid this fluids like caffeine, avoid fluids which causes irritation of bladder like caffeine, alcohol, fizzy drinks. And secondly, we ask them to retrain their bladder, because bladder, the urination is a reflex which is between your brain, spinal cord, and bladder. They work together. So once you go to the urination frequently, it becomes a habit. And you want to break that cycle. So you tell your brain not to go or delay that, and that is called as bladder retraining. So you avoid going frequently and try and delay it as much as you can. That is sometimes helpful, and avoid that cycle of going to the loo frequently. But if that doesn't work, then we tend to give them medication, basically to relax the bladder muscle, because you have a bladder muscle which is overactive or which is contracting unnecessarily. So these drugs mainly act at the bladder to relax the bladder muscle and reduces the frequency and urgency of going to the toilet. Some of them have side effects, like you can get dryness of mouth or constipation. Hence, sometimes patients don't tolerate them and they stop taking this medication. But certainly worth trying in women with the urgency and frequency of urination. Failing that, the women who have this problem and they're constantly on the loo and they're wetting themselves, then we offer them the treatment called Botox. A lot of people have heard the Botox is used on the face for wrinkles. Similar Botox we use to give inside the bladder. And by giving that, we causes relaxation or paralysis of bladder muscle. Hence, they retain more water. And hence, they go to the loo not that frequently.
So is the Botox a one-off treatment, or does the person have to?
Unfortunately not. I think that is where the Botox wears off between 6 to 9 months. So generally 6 to 12 months is a duration for the Botox. After that, you may have to repeat the Botox treatment. So it is done as a day case. So the patient comes in the hospital. We can do either in the clinic or sometime in theater, and patient can go home immediately. But requires repeated injections.
Right, and this is for urge incontinence.
Absolutely. This is for urge incontinence, which is not responding to the medication and other general measures. Other treatment available is called neuromodulation. As I said, it is a reflex coming through your nerves. So you can fix a transducer, electric transducer, which gives a stimulation into your spinal cord and reduces the irritation of your bladder. So it causes, again, relaxation of bladder, which can be done through the small operation onto your back. Alternatively, we can give a stimulation of nerve in your leg, and that can cause reduction in frequency. Obviously, it is not as effective, but that can be done easily in outpatient setting where you give a little bit of electric current into the nerve going through your leg to your bladder. That is given every half an hour weekly. We give about 5 to 6 sessions of that. And then you have to give sometime booster doses as and when required. So these are the ways we treat urgency or urge incontinence.
Yes. What about stress incontinence? I know you mentioned.
The stress incontinence mainly pelvic floor muscle training,
Yes.
and the transvaginal tape. These are the two operations we do. Sorry, two treatments given for this stress incontinence.
Right.
And urgency is treated with treatment like medication or Botox.
Right. So that now brings me to what if someone has the mixed one? Does he get the two treatments together?
That again then depends on what is the major issue in that particular woman. If she says my urgency problem is worse, then we treat that as the first one. And we tend to do urgency problem more seriously and treat that first, because once we do the surgery for stress urinary incontinence, sometimes the urgency gets worse. Hence, we make sure the urgency part of the incontinence is treated before they have a treatment for stress incontinence.
Right. So the urgency one is the one we talk about. We call overreactive bladder. That is they do not allow the person to hold the wee. The person has to go.
Absolutely.
All right.
Absolutely.
Interesting.
Caffeine intake is important. People do talk about decaffeinated drinks, which is another way of reducing the caffeine intake. But ideally, reducing the coffee is a way forward. And other problems. And excessive drinking will obviously cause more frequency. So you drink in moderation, which is about 1.5 liters of fluid in a day. And usually try and avoid drinking tea, coffee, especially. Sometimes people have a glass of wine or tea or coffee before bedtime. And that's something, if you have a urination at night, you can avoid that, and that will certainly help them to reduce the frequency.
Now, from what he said, some people stay at home, they don't want to go out because they are shy or because they are afraid of, wetting themselves. It doesn't have to be. Always seek medical advice, because these conditions are treatable and you can get help very quickly. So, Dr. Thakur, I thank you for coming to Health Corner. Viewers, if you have any question for the specialist, please look at the number, send us text, or look at our website or send us email, and we welcome people who want to partner with us in form of sponsoring the show. We'll bring in very good consultants like Dr. Thakur, and I'm sure you will hear many other speakers, talk on health show. So stay tuned and always tune into Health Corner every Saturday.